Okay, so for PNF techniques are done when you have a tight muscle and you want to stretch it. They're very, very effective, especially in sports therapy. So a PNF technique, the first one is called contract relax. Contract relax is the easiest to understand. It helps to stretch the muscle that has been limited in its range. So that muscle is called the range limited muscle. So we are going to, so this patient right now is having a hard time stretching out his flexors. He works with his hands, his flexors have become very, very tight. So when I try to stretch out his flexors, it doesn't matter which one, all the flexors are tight. And this is his barrier. He can't go further than this. So I'm going to keep it at the barrier. And now from the barrier, I'm going to contract this muscle for 6 seconds. So can you push into my hand? 1, 2, 3, 4, 5, relax. And then from the place where he contracted, I'm going to see if I was able to get a little bit past the barrier. Oh, well, look at that. Originally he was here and now he's able to extend a little bit further. So his range has increased. You would repeat this 2 to 3 times. So again, from the new range, can you contract? 1, 2, 3, 4, 5, relax. And stretch. Oh, wow. And look at that. Now he has a much better range. So that's the whole goal of PNF, is to contract this muscle, then stretch this muscle of the contract relax. Now the next technique is called agonist-contract. So it's called agonist-contract, although I think it should be called antagonist-contract because it's the antagonist that's going to contract here. So we're going to use the flexors as an example again. Same patient, he's not able to stretch his flexors. So when I ask him what his barrier is, he says, that's it. I can't go any further. So this time, instead of contracting the flexors, maybe because it's too painful for him to contract the flexors, this is when you would use the agonist contract instead. So instead of pushing my hand upwards, he's now going to push into my hand downwards. So push into my hand downwards. 1, 2, 3, 4, 5, 6. What did he do? He contracted the antagonist here. And now we're going to stretch out the flexors. Oh, wow, look at that. Now he has more range. Repeat again. Can you push into my hand? 1, 2, 3, 4, 5, relax. And he has more range. There's a principle called reciprocal inhibition, which allows for this to work. Why is contracting this helping stretch this out? It's because of that principle. That you will learn more in KIN 101 and KIN 102, how that principle works. The last technique is called contract, relax, agonist, contract, or the other name for it is contract, relax, contract. So it has 2 names. If you look in your rubric, it'll show you that it has 2 names. So again, we're going to use the same range limited muscle. The range limited muscle is the flexors. He cannot extend them. So we are going to ask him to come to his barrier. Okay, that's his barrier. And now we are going to contract our range limited muscle. So resist into my hand here. 1, 2, 3, 4, 5. And then right away, he's going to resist into the other one. 1, 2, 3, 4, 5, 6. Relax. And now we go into a further barrier. So that was contract, relax, contract. Is that you contract the flexors, you contract the extensors, and then you relax. So that's it for the PNF techniques.